guys, happy Tuesday. I hope you're all doing well. My topic for the next few sessions of my Therapy Tuesday will be based around teenagers. I've gotten a lot of requests over the past 2 years to speak more about teenagers, and I've kind of always shied away from it just because it's not the vast majority of my patients. But with the event that has happened recently and the panic that all of us parents are feeling towards school-age children and adolescents, I thought it would be a perfect time to talk about mental health in relation to adolescence. So the same types of anxiety disorders that apply to adults can apply to teenagers as well, except that they may react to them differently. And the reason being is because they are still developing, their logic is still developing, and their sense of reasoning is still not as complete as an adult who is over the age of 21. So I would like to start with the most common types of anxiety disorders for teenagers. And the first one is generalized anxiety disorder, also known as GAD. And that is the intense anxiety towards multiple objects in life. One of the most common anxieties that children that have GAD experience is how others perceive them. Most likely, how is it that their peers are perceiving them? How are they perceived at school? And they really crave that family love and family environment. That's kind of their safety net, their place that they want to be in most of the time. Kids with GAD or adolescents with GAD usually have an intense fear of the future, what their life will look like in the future, what they will be able to achieve in their future is something that is constantly on their mind. And they are usually needing a lot of reassurance from people around them, even their friends. They will find one or two peers that they feel comfortable with, and they might ask them the same question over and over when it comes to something that they're feeling insecure about. So they might ask, oh, do I look good, like 3-4 times from the same friend. They might ask if my shirt has a stain on it 3 or 4 times, even though their friend says you're fine, it looks good. They might ask over and over because they're really craving that reassurance from a few people in their life that they feel safe with. And again, usually it's their family, it is their home that they feel very safe with, and a few of their friends. Social anxiety disorder when it pertains to adolescence. This is one of the most common types of anxiety disorders in adolescence, and it is because teenagers in general have a higher worry level when it comes to how other people perceive them. And so that's why this is one of the more common types of anxiety disorder. So basically what social anxiety disorder is that it is an intense level of fear and anxiety when it comes to how other people, especially their peers, perceive them. Teenagers that experience this level of anxiety experience a group of symptoms normally put together, and that is excessive sweating, heart palpitations, fear of speaking in public settings, fear of speaking in front of the classroom. They usually shy away from after-school activities. They do not like joining their different types of clubs, and that's kind of rare because usually teenagers really love that stuff and they love to do anything that involves their peers and their friends. So this is a great indicator. If a teenager does not like to do after-school sports, join any clubs, they don't like to go to their friends' homes, they don't like to socialize, they are usually feeling some sort of an awkwardness when it comes to socializing. They usually tend to have 1 or 2 friends and they really stick with them. They usually feel very out of place at school. They don't like to go to the school dances. They don't like to go watch the games. So they basically shy away from all kinds of peer-oriented activities. When they are feeling anxious, they usually experience excessive sweating, blushing, shaking, rapid speech, having a hard time speaking. And unfortunately, one of the main side effects of these experiences is that they turn to drugs and alcohol to kind of put a band-aid on how they're feeling. Many of them will kind of explain how having a glass or 2 of alcohol really calms their nerves and allows them to be more social and allows them to enjoy parties or a bigger group of friends. This is very unfortunate because they normally don't know how to hold their alcohol level, and they will drink beyond what their tiny bodies can take, and they will get belligerently drunk. And unfortunately, because this allows them to be more social, they will forget the negative side effects of how they felt the day after, or even the blackout, and they will crave it again and again. And that's why teen addiction is such a real problem, and it is so prominent in those kids that are experiencing social anxiety. My hope is that by sharing this, you parents or older sisters, older siblings, or aunts and uncles, if you guys are listening, you will take note of this. And if you see this behavior in your teenagers, if they're shying away from their school events and all the stuff that I just went through, you will look at this as an alarming fact, and you will have an open conversation with your teenagers about this, because there is so many countless resources out there to deal with social anxiety disorder or generalized anxiety disorder when it comes to adolescents. Thank you, and I will see you guys next Tuesday.